To this now, Gifters of Givers will on Saturday celebrate 30 years over the years the organization has served humanity unconditionally, irrespective of race, religion, color, class, political affiliation or geographic location. Now, to tell us more about the organization and plans to celebrate, we're now joined via Zoom by Gift of the Givers founder, Dr Imtiaz Sooliman. Dr. Sooliman, thank you so much for joining us this afternoon. A great pleasure to have you on the show. Firstly, congratulations on this amazing journey, 30 years of great service. Before we talk about the celebrations, I'd like us to paint a picture of when for you decided that you are going to put everything aside and work for the humanitarian of basically, the global citizen.
Good afternoon. Thank you very much for your kind words. Gift of the Givers is not my organization. I didn't get up one morning and say, let's form an organization, give it a name, get some founding members, do a constitution, and start helping people. Gift of the Givers is a spiritual calling. I met a spiritual teacher in Istanbul in 1991, and again in August 92. And on the 6th of August 1992, which coincides with our 30 years this coming Saturday, at 10 p.m. at night on a Thursday, he looks me in the eye, and in fluent Turkish, he tells me, my son, I'm not asking you, I'm instructing you to form an organization. The name in Arabic will be Waqful Waqifin. Translated, it means Gift of the Givers. You will serve all people of all races, all religions, all colors, all classes, all cultures, of any geographical location and of any political affiliation. But you will serve them unconditionally. You will expect nothing in return, not even a thank you. Serve people with love, kindness, compassion, and mercy, and remember the dignity of man is foremost. This is an instruction for you for the rest of your life. And remember that whatever you do is done through you and not by you. It started that night. A spiritual instruction from a spiritual teacher, and that's been going now for 30 years.
30 years, 44 countries, I believe, more than, worth billions of rands of aid that you've provided. I mean, it's an exceptional work. But of course, when COVID-19 hit, it shaped the course of many organizations. I would imagine your work also took a different turn. Talk to us about the last couple of years. How have they been for your organization? And I mean, also the humanitarian need became slightly different.
Well, from 2017, we were promoting, focused, not that we were focusing any less in South Africa before. It's just that our work became more visible from 2017. But to answer your question, in COVID, the floods of 2019, including Cyclone Idai in Mozambique, Malawi, and Zimbabwe, the COVID of 2021, the unrest of 2021, the floods of 2022, all these events gave us exponential growth. And we saw the suffering of South Africans, and we had to increase our delivery and our support for South Africans, fellow citizens who were in real crisis. And it was not poor people that were in crisis only. It was rich people that were in crisis also. People lost their jobs suddenly. Medical guys who were unwell in hospitals. We had this terror of being faced by COVID. Medical healthcare were dropping dead. There was not enough PPEs in a public hospital. And we came on full on into 210 hospitals. My staff came up to meet the challenge. PPEs to 210 hospitals, video laryngoscopes, high flow nasal oxygen machines, CPAP machines, sanitizers, gloves, all the different types of masks, coveralls, scrubs. And of course, then we specialized slightly further. We started setting up oxygen facilities, oxygen wards, infrastructure upgrades, upgrading hospitals, putting in beds and linen, putting our own testing teams to do the PCR testing, 10 testing teams with mobile teams moving throughout the country to help support and get tests quickly done so the people know what the condition is. Put in 37 tents for triage in hospitals at 3 million rand a month at a cost. So patients first go in the tent. They check if they're safe to go into the hospital, and then they go into the hospital. And of course, then came water was required to the hospitals. Patients had no food. We had to put food for patients. Then they needed medical equipment and medical supplies. And then came the lockdown and hunger. We delivered with COVID and the unrest more than 1.2 million food parcels. We supported feeding schemes. And it went on and on. Came the floods. Similar type of thing, providing people with shelter, giving them blankets, nutritious meals. And then this year, with the floods this year, We brought in our own search and recovery teams, made helicopters available, made equipment available, provided uniforms for kids who lost everything. We're upgrading schools. We're doing jetting, which is clearing the stormwater drains at several schools. We drilled 17 boreholes in Togat because the water system is destroyed. We're drilling boreholes in Amzinto, in Malawi, in Median Hill, in Pinetown, in Harding. And right now, as continuation of the floods and the other challenges, we're busy in Nelson Mandela Bay Metro because of the water crisis there. We've already drilled 25 boreholes. And what all the interventions we're doing, we are now providing close to 8 million liters of water a day in that city.
Dr. Sooliman, thank you so much for your time. I'm afraid that's all the time that we have. Again, congratulations. And I mean, it's been a fantastic journey. We can only emulate what you are doing from here onwards. I know that you've said South Africa is one of the best countries in the world in terms of, having, been across every other part of the world. This is one of the best countries. So thank you so much for your time and what you do.
Thank you very much. Not one of the best, it is the best country.